Hi, everyone. I'm so excited to be here and see such a big group of people. And I'm going to talk about why we should be investing in FHIR. And just now, when Dr. Russell was talking about FHIR, surprisingly, did you know when we mentioned about API, which we say Application Programming Interface, it actually means fire in Bahasa Indonesia, API. So, why is it so important, API? Because it's not about if, it's really about when. FHIR is an interoperability, not only taking care about the meaning of the data, what we call semantic interoperability, it is also very important because it is built for the new generations. Fast health adoption is what FHIR is about. It's based on web technologies. So I have two children, and one is the millennial, and the other one is Generation Z. And they loved everything that's built on web technology and e-commerce. It's about sharing. Now, FHIR is open, but also it enables us to embrace the web technology using these API or APIs in order to be able to respond and also receive on the internet. There are no other healthcare technologies or health information exchange standards like that. When we talk about standards, I'm using this as an example. This is called a standard. You go to Japan, the US, Singapore, you have all kinds of standards. So we need to agree on a health information exchange standards. In banking, they have this SWIFT standard, which is for exchange of money. But over here, we have a labyrinth of different types of standards. It is time for us to unite and agree on a standard that is meant for our future, especially when we talk about in Indonesia, where we have 27 million population of people who are just born in Gen Z. And also you have 25 million who are children. These are our future. They are going to shape healthcare. So make no mistake, this is really about how we can embrace the future. So I will use Satu Sehat as an example because they have this four simple stage, which seems to be very easy because first you need to be coming on board. So you need to have a security feature to be going into Satu Sehat to be able to secure a unique key, right? The second thing is to prepare the inputs. Now, preparing the inputs is not that easy. It's easy maybe to identify, but extract the data in something that's quite fundamentally flawed because data extraction is based on being able to collect the data consistently and accurately. That's not an easy task. And then later on, how you're going to actually automate the process, like we have done in Premier Bintaro, where every night they're collecting data, transforming it into FHIR format, and sending it via JSON API into Satu Sehat automatically. So it's not just about being able to extract, it's about scalability, how you can do it without trying to use too many of your resources to do it manually. And lastly, to be able to send the curated data not only to Satu Sehat. Now, Satu Sehat is only tip of the iceberg. Now, the moment you send your people, have your people extracting the data, curate it in a nice manner, you suddenly realize that, oh my goodness, I have been cleansing my data, and now I have a set of curated data. And these curated data can be so interesting for me to build artificial intelligence and all these applications that's coming up because I need my artificial intelligence to be based not on biased data, but on consistent and accurate data. So Dr. Russell has talked about resources. It's not about human resources, as you heard. It's about how you actually structure your data to be able to have a clear understanding of information exchange. Let's use this use case one in Satu Sehat as an example. Do you notice that just having a structured way to know patient data, who is a practitioner person who is actually taking care of the patient, say the patient has chronic diabetes mellitus, and which hospital is treating the patients, what kind of medication the patient is having, and what kind of condition the patient is. Now remember, this is health information exchange, not to mix with the code and terminologies that Dr. Russell was talking about. We spoke about SNOMED CT, ICD-10. Those are code and vocabularies that you use to place, for example, conditions, the code of the patients, and also maybe for lab results, you use something called LOINC. These are just vocabularies. Do not mix that with the health information exchange standards. I'll tell you in Indonesia, the standards you're using, it's still built before 2G existed. It's called HL7V2. All the medical devices you're talking to are built on that. And let me tell you this, the future of watches and all the commerce company like Apple and wearables and sensors, even this particular inhalators has sensors that can measure how much you inhale. All these new technologies built by the millennials and Generation Z, they don't use HL7V2. They built on FHIR because FHIR embrace web technologies. It's not only committing on looking at the content, but it's also taking care of the logistics. So what you don't put in, you don't get out. So it's very important to be able to share. So remember, the combination of it actually allows you to have a longitudinal health record of a patient. So this is why Satu Sehat is so important, because you have 279 million population, 17,000 islands, and this huge population, very diverse, where you need to be able to enable artificial intelligence. But before that happens, you need to have interoperability. You need to build the right foundation. So this is how we're trying to do. Oh, okay, I think, sorry. This thing just disappeared. So remember, being able to embrace FHIR is not just about complying with Satu Sehat. It's actually very vital for your organization because you can structure your content in something universal. I will give you examples of it. Japan, where FHIR has been a standard. So it doesn't matter if you're in Japan or United States or in Indonesia, you are able to speak a language that's accessible and universally understandable. So hence, you can build your own analytics. Later on, we're going to have Kate and a few others who are going to show you how you can build. Once you have curated the clean data, you can build analytics based on your standardized FHIR data. And then most importantly, you can build your mobile apps also on FHIR standards. And to embrace the young generation who builds on Pythons and all the others on FHIR standards, to be able to welcome them to build new technologies like sensors, like wearables, that when Pak Setiaji was talking about telemedicine, remember, telemedicine is not just about video consultation. It is actually being able to put medical devices to be able to calibrate it for your patients to be able to measure glucose level, weight, and everything to monitor them over time, and maybe having someone who's able to find the anomalies, to be able to also see inconsistent data, to be able to save this patient. So it's very important to embrace telemedicine. You need to embrace FHIR. And also, of course, to future-proof the data and to be able to share with the rest of the world. So in a way, IRIS is what it is about. Because everybody thinks that to embrace FHIR, all I need to do is to talk to companies that knows FHIR. But I'm sorry, you have built so many different healthcare standards. This is what makes IRIS for Health so powerful, because we not only understand the language of the future, we understand the language of the past. You need to be able to know all these different standards, like CCDA that was very focused on content, HL7V2 more gearing towards the logistics side, and then FHIR. So all these things, because you need to be able to, because your technologies in the hospitals is not just built on FHIR. So it's a shiny new toy, but you need to be able to embrace it. Now, this is one example of how we help our track care customers to do it. We produce a separate instance of IRIS to help them to be able to connect to the world. We have all these radio adapters to be able to talk to mobile applications built on FHIR, Apple Watches built on FHIR version 4, and then built on the future of version 6. And this is what it is about, okay? I know that there are many actors offering FHIR technology, but no actors provide the full architecture. We have a very transparent way of including everything. We know that in future, you're not just going to build something that is on a mobile app on FHIR, but you also need to be able to make sure that you have security, ability to manage all your APIs, so monitoring and all this kind of stuff. So we give you all. We are a gigantic toolbox that gives you everything. There's no such thing as breaking down into pieces and selling you like that. We don't do that. This is the way, the integrative way of providing the full infrastructure. So I think we have someone from Osaka University Hospital here, and these are just some of the projects they have done. Now, FHIR is also used a lot to work with clinical research repository and data model like RedCap. We now recently also launched FHIR to OMAP, which is another data model used by clinical research scientists. And I think Indonesia is very underrepresented when it comes to clinical researchers. Things are changing because your health minister is building several genomics next generation sequencing lab. There will be more and more such research going on, and I think Indonesia has a responsibility to share that information with the rest of the world. So these are just some of the models that we're using, for example, in Osaka University Hospital. Now, there are a lot of initiatives going on. As you can hear, I'm actually from Singapore, and I was speaking to the Synapse, which is the government IT body of Singapore. They are using FHIR to build several mobile applications, 36 of them, and they call it FHIR Nexus. So we also have My Sejahtera in Malaysia trying to follow Satu Sehat to build their national electronic health record based on FHIR standards. And we also have the FHIR initiative in Thailand we're speaking to. And again, coming back to Internet of Things, we are going to have 50 billion Internet of Things all connecting using this technology. And I really hope that we can embrace this in a way where we can actually set the stage for AI and also embrace personalized medicine and predictive analytics into greater heights. Yes. Thank you very much for the session.